Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, joined in studio by the crew from NeuroKinetics Clinic in Vancouver. We're going to talk on the program today about performance enhancement and restoration. It's a pleasure to welcome back to the program Philippe Silvestre, who is the president and founder of NeuroKinetics in Vancouver. Dr. Silvestre, welcome. Philippe, it's good to see you again.
Good morning, Sterling. The same here.
Well, it's nice to have you along with us. Sonia Dale is the clinic manager and is always welcome in our studios. You're a bright ray of sunshine on any radio program. Nice to have you back with us.
Thank you.
And JC is with us too. JC Gordon is Director of Logistics for NeuroKinetics. Welcome back.
Great to be back, Sterling.
So who wants to take the first question and the most obvious one? We're going to talk about an outfit in Vancouver called NeuroKinetics. So the obvious question, JC, we'll try you on this one first.
Excellent.
What is NeuroKinetics?
NeuroKinetics is a traumatology performance clinic for those that are having health problems.
Okay. So as we mentioned, the program today is going to focus largely on performance enhancement and restoration. So you can't enhance something until you've restored yourself to the point where you're able to enhance something. So talk to us about pain and performers as it relates to NeuroKinetics.
Well, unfortunately, life throws curveballs at us, Sterling, and most of us like to perform at an optimal level, but that's not always possible.
Right.
And what we do for our patients at NeuroKinetics is help them to remain in that optimal place as long as possible. And we're talking about professional athletes, we're talking about high-end executives, and we're also talking about the average person on a day-by-day basis.
Sure.
Life always, unfortunately, throws... it could be an accident. It could be a stress-related situation that doesn't allow us to perform the way that we know we want to.
Okay, I have one for Philippe Silvestre now, and this I boosted from the website, I confess. And I'd like you to sort of flesh it out for me. Let me quote, okay? At NeuroKinetics Clinic, they merge the best of brain neuroscience, knowledge and methods of Western medicine, and the philosophy and techniques of Eastern medicine to achieve long-lasting results. You are the product of Western medicine. You're a former flight surgeon in the French Air Force. So you are a typically and traditionally Western-trained doctor who moved to Canada decades ago, moved to Vancouver by choice, being a mountain guy, and us having a lot of mountains in the backyard, and you discovered Eastern medicine. And so over the years, since you founded NeuroKinetics, Philippe, you've managed, it's based on a merger of Eastern and Western medicine. Talk to us about how that came about and what it means, this hybrid Eastern-Western medicine approach.
Thank you, Sterling. This is a very good question that will explain a lot of tying the dots through my career and what is NeuroKinetics, the NeuroKinetics clinic about. I began my career as being trained as a Western medical doctor, as you say,
in
with
France.
Different specialties
Right.
in France.
Mm-hmm.
And I started my career with a major in aerospace medicine and space medicine. That is tying with performance big time.
Okay.
And then, by the end of my medical studies, Western medical studies, I opted to further training in Eastern medicine, which was offered in a university in Marseille, in Faculty of Medicine.
Oh, so you began your study of Eastern medicine in Europe?
Right away.
Interesting.
Yes.
Okay.
So that when I began actually my career, I had the double training. And then I went for a PhD in brain, cognitive and behavioral neurosciences, which is nothing else than understanding brain controls, whether physical controls or mental controls. And that ties also with performance, because if the brain controls are unset or dysfunctional, that will bring the performance down.
Okay, and by the way, speaking of performance, and Dr. Silvestre, JC, is far too modest to go into this, so I kind of have to do a root canal and get him to talk about it on the radio. Just a very few short weeks ago, at Oxford University in England, our guest, Dr. Philippe Silvestre, was initiated into a new and rather exclusive fraternity. You became a member, you are part of the aerospace. You mentioned your background and your medical and academic training deals a lot with aerospace. So tell us about the newest accomplishment, please, and don't be modest about it.
Yes, a few weeks ago, I left Vancouver for a couple of weeks, during which I was inducted as an academician at the International Academy for Aviation and Space Medicine.
The International Academy of Aviation and Space Medicine. But this goes even beyond that, because you're already working with people in that very, very limited discipline with establishing some kind of medical facility in space. The moon first, is that the idea?
And now Mars.
And now Mars. Okay. Okay, well, all right. So you talk about, now, Sonia, here you are. You're the clinic manager at NeuroKinetics. Yes. You've got a guy who's trying to build a hospital on Mars, for crying out loud. And in the meantime, you're the person who answers all the emails or picks up the phone when people call NeuroKinetics, yes, particularly after hearing about you on the radio on a show like Boomer Life. And when someone calls the clinic and wants to speak to the famous Dr. Silvestre because they have problems, and we're talking today about performance enhancement and restoration, but a lot of that really just boils down to pain. I hurt. This happened to me, and I've never recovered. That's where a lot of it starts, right, Sonia?
It does, yes. Trauma-related, effects, later in life, there's pain added to that. Anything pretty much where someone would call in where performance enhancements is anything that they want their body to be restored or reset again.
Right.
So, they will call in and say, you know what, I'm losing that edge. Pretty much is what I usually hear a lot.
Okay.
And, how do I get that edge back? Or how do I, how do I do things as I used to do them maybe a year back or 6 months back? Why do I feel like a little more tired or I'm getting fatigued? I'm not able to sleep as well as I used to.
Right.
So there's certain things that we can, come on in. We can help you with that. Let's discuss things further in detail.
Right. And Philippe, when one is in chronic, constant pain, as Sonia has described a lot of people saying to her on the phone, it goes beyond the physical after a while, doesn't it? Because then it becomes partly mental. If, for example, you are seeing doctor after doctor and you're trying to describe your condition, you're not receiving any satisfaction, no one is listening to you and responding to you, so you go around the block a few times and you continue to be in pain, you continue to be misunderstood by practitioners, and after a while, you start to get a little depressed. You're starting to figure, gee, is anybody going to lock on to what I'm trying to say here? I hurt because this happened to me, and I really would like to have my life back. And that gets into the psychological by that point, too, doesn't it?
Yes, it does. And there's a good reason for that. We know it now in the light of state-of-the-art brain neuroscience. It is not an organic issue. It is not or degeneration or damage that caused this. It is not either about energetics as Eastern medicine sees it. It is a kind of brain physiology effect and deficiency that occurs when too much of a given symptom, pain in particular, will drain the capability, the energy capacity.
Sure.
Like a hole in the bottom of the bucket. Whatever the size of the hole is, we lose that amount of water which is in this bucket. So the same about brain performance, which needs a lot of processing. And now with time, we introduce the concept of cognition. For those who are not familiar with, you may compare cognitive processing with the software on a computer, comparing a very sophisticated entity such as the brain to a very simple computer hardware, including composed with a hardware and a software.
Okay.
So the hardware is anatomy, and the software is the cognitive processing as far as we are made up.
Okay.
And if we have too much of a symptom or bother, we'll be diverting an increasing amount of processing to deal with that and that will be at the expense of other areas
Right.
of performance or even wellness and health.
I was just going to say, we start setting aside big chunks of life in order to accommodate this painful reality that becomes larger and larger, it seems, by the day.
It's about energy management.
Right, right. Now, JC, you wanted to jump in here too?
Yes, Sterling, I just wanted to say that the patients that who are looking to enhance their performance that have come to have seen us, it's a simple analogy of what's going on is the software isn't operating correctly.
Right.
And that's what we do at NeuroKinetics is get that software operating correctly. And when we do that, the performance is always enhanced.
Right. Now, Philip, there's a pattern to all of this, and the pattern tends to repeat itself, especially for a professional like yourself, because this is the way you've developed a method, a style, a certain approach to dealing with clients and patients in pain and in other discomfort. And so we talked today about performance enhancement and restoration. So really, it's restoration first before the enhancement. Talk to us about the pattern, because there's a cycle that virtually everyone goes through.
Yes, this is a very fundamental understanding that helps to understand what is brain physiology and that is underlying performance at all times.
Okay.
Whether when we are awake or even when we sleep. First of all, we have to admit that we are born performers, and unless something has happened to us adversely, we have meant to perform at our best, optimally.
Okay.
Now, if we become tired or worn out by repeated adverse things that will begin to drain our energy, or we get hurt in a significant traumatic circumstance, whether physical or emotional or mental, then the brain will begin to shift strategy to cope with the consequence of the trauma, and minimizing the impact of this trauma.
Right.
Now we get into a dysfunctional state, which will lead to the rise of symptoms and the loss of performance. This is simultaneous. Then, if nothing is done, the next adverse momentum that will occur will compound with the unfinished business as far as the resolution of the previous trauma is concerned, and things will begin to compound adversely.
So the brain develops coping strategies, as we mentioned, and in some cases it involves really turning your life inside out in order to accommodate this new, very painful daily reality. Yeah. And so if you just do that coping strategy and don't do anything else, it's not really going to improve anything, so ultimately it's going to fail.
Yes, and it's going to increase adversely, which means symptoms will rise and will spread through particular ways that are tied with the nature of the trauma and what was the body and the mental states at the time of the trauma.
Right. And Sonia, when people call you to have a chance to meet Dr. Souvastre and your team at NeuroKinetics, a lot of them are incredibly frustrated. Besides being in pain, it's because of this, the fact that they've had to deal with this condition for so long. They've literally adjusted their lives in a way that they'd never expected to, and are frankly not very happy with. But it's a necessary adjustment. It's survival skills kick in after a while, isn't it?
That's exactly it. It's that's their survival skills kicking in. It's also a lot of them, when they do call in, it's a feeling of I feel, afraid. Mm-hmm. It's the fear factor that comes in. It's the trauma. It's a feeling of isolation. It's a feeling of disconnect from the rest of the world. There's so many feelings that they do share just over the phone that it's a feeling of hope is what I hear a lot of time after they've are close to hanging up the phone with me when they're going to book their consultation and saying, thank you very much. I feel like someone is actually hearing me out and someone is here to provide the hope that I was looking for that I clearly didn't have anywhere else that I've been to.
Well, I would imagine, too, JC, that a person who calls the NeuroKinetics clinic and who has seen a variety of different professionals and received very little satisfaction, maybe a prescription or two, but not a lot of improvement.
Yes.
By the time they come to you, there is a huge degree of frustration, but also they really are looking for hope, aren't they?
Absolutely. And that's what I hear a lot of times, too, with people that call us and express that frustration, Sterling, of of, in some cases, tens and tens of years of no one listening to them.
Right.
No one actually listening to what they're saying. And that's so very important for us to understand what our patients are experiencing,
Right.
even at the initial call-in stage.
Philippe, is it always about learning to manage pain, or is it possible that people get actually cured?
Well, this is another very good paradigm
Yes.
which characterizes our approach. I am used and I have learned to say that now we are in a resolution business rather than a management business.
Good, okay, all right.
Yeah.
So there is a distinct difference, isn't there?
Very great difference, totally. When you resolve something, that means you don't have to, it's no longer in your scope of action.
That's right. It's over. It's
Yes.
resolved.
Yes.
The hope that was placed on the professionals at NeuroKinetics has paid off, and I feel a whole lot better. I got my life back.
And so do we.
Our guests in studio are from NeuroKinetics Clinic, which, by the way, friends, is in the Highcroft Medical Center building on Granville Street, right there by 16th Avenue, just down at the bottom of the hill before you head up to where the rich people live. That's online, too, at neurokinetics.com. And NeuroKinetics, we'll do the spelling once. I think we really should. It's
Sure.
NeuroKinetics, neurokinetics.com. Check it out while we take a quick break on Boomer Life on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL. Back. This is Boomer Life on CL 650.
And welcome back to Boomer Life here on CIL 650 as we continue our conversation with the folks from NeuroKinetics Clinic in Vancouver. Our guests in studio are Dr. Philippe Silvestre, the president and founder of NeuroKinetics in Vancouver. Sonia Dale is the clinic manager, and J.C. Gordon is the clinic's director of liaison and logistics. And we're talking about performance enhancement and restoration. And you know, boomers, we're kind of a different crowd. We've been doing stuff differently, JC, and you're a card-carrying boomer just like I am, and so is Philippe. Sonia, on the other hand, has yet to enter the club and is in no hurry whatsoever, and nobody's blaming you. But, you know, boomers, we've always done, ever since the 50s and 60s, we've done everything differently. We've done things our way, and by gosh, we're also rewriting the book on aging. Boomers, these days, are certainly fitter than our parents were at our age, and, well, I frankly, a large number of us intend to stay fit by continuing to take on challenges, just doing things that keep you energized. And in some cases, we are people looking to keep that edge. Sonia was talking earlier about people who call up and they're just a little nervous. They're concerned. They feel like they're losing that edge, Dr. Philippe. And so when a person comes to NeuroKinetics and isn't particularly suffering from a traumatic injury, so there's not a lot of brain issues to deal with, but that person is looking to maintain a certain high level physical activity, and if anything, to be able to, even at boomer age, improvement, to constantly challenge oneself. What can you at NeuroKinetics do for people who just look to keep that edge nice and sharp? Thank you very much.
This is a very good question. We look for identifying what has been eroding this capability of energy that underlies performance.
Okay,
so
you want to keep your edge. Why do you think you're losing it, right?
Exactly.
Okay.
So there are many ways to get there. It could be a physical issue, even mild, which on the long term will erode the coping capabilities, and that will be still below the threshold of awareness, and we basically lose a part of our sensory motor capabilities, tuning capabilities, dexterity capabilities, and it is in total unawareness about that.
Okay. Now, is part of that, though, because we're talking boomers here, so as one ages, no matter how resistant we may be to the idea, certain things in one's body just don't do things as fast as we used to be able to, and yet that's not enough of a reason to feel like you're losing your edge, is it?
Okay. There is a two-layer answer here.
Okay.
First of all, we cannot deny that as we get older we get wiser. And this is.
Oh, I thought you were going to say creakier, but wiser. I like much better. Okay.
We get wiser as we all learn from our lessons on the way. Somehow, this said, aging is a reality.
Sure.
It wouldn't be exact to deny that. Beside that, there is a new paradigm that we have learned from state-of-the-art brain physiology, which shows that brain control dysfunction that are increasingly coming into the picture of even a well-being and performing individual because of the amount of erosions I just mentioned earlier,
Sure.
will begin to underlie and weaken our cognitive processing, which is the software the brain uses to substantiate anything else.
So even though there may not be a real noticeable or identifiable a physical issue, you're suggesting that at all times it's always partly mental.
It is not mental. Cognition is not a mental thing. Cognition is what people in the street calls the body-mind connection.
Okay.
It is rather a software, a processing. It goes from a cellular pattern to a systemic pattern, so it is all up and through the hierarchy that makes us up anatomically and physiologically.
Okay.
So to keep things simple, it is the between the physical and the mental that is the issue. It is not the mental.
Okay. So, and of course, I'm using the word mental probably incredibly inappropriately because all I was referring to was it was in some way relating to the brain as well. Your brain is involved in everything you do, like it or not, in many cases involuntarily.
Yes.
Right?
And that is a third entity of operations. The brain is the place.
Right.
Of.
So when someone comes to the clinic, to maybe get that edge back, maybe sharpen the skates, so to speak.
Right.
JC, when there is an intake process, and we'll get Sonia to walk us through that. Does every person who comes to NeuroKinetics receive the same process, or if you identify yourself as being probably pretty okay health-wise, I don't have any major pain, and certainly I'm not living with chronic pain, I just want to get my edge back. Would the intake be different than a person living with a great deal of pain?
That's a great question, Sterling. At NeuroKinetics, we are brain optimization specialists.
Right.
And to optimize the brain, it's the same initial pattern that we need to follow over and over again to determine where the brain is basically at this point in time. And what Dr. Philippe does in the initial assessments that we do with our patients is measures that level of dysfunction. And we, as we work with our patients, turn that dysfunction back into function, which enhances the performance and certainly helps with physical issues as well.
Okay, so Sonia, if now that we've learned that everyone who comes to NeuroKinetics to see Dr. Silvestre and the rest of your team goes through essentially the same intake process. And as I recall from previous conversation, there are 3 intake occasions. 3, would you call them interviews, exams? How do you describe those meetings?
They're assessments.
Okay, assessments.
So you would start off with your first meeting or consultation, that is, to go ahead and, set up the next appointments, which are the assessment appointments. The assessments, the level 1 or the GCSA that we call it, is anywhere between 3 to 4 hours, sometimes can lead up to 5, depending upon the, medical history that we go thoroughly into, Dr. Philippe goes into thoroughly.
Right.
And then the same thing with a level 2.
So I'm sure I have to stop you. 4 to 5 hours for
Yes.
the first meeting with the doc?
Yes.
I imagine you just absolutely shock patients.
We do.
Especially people who have been around the block and seen 24 docs in the last 2 years and an average time of maybe 10 to 15 minutes each. Suddenly, I get 4 hours
Yes.
with a doc. Are you
Yes.
kidding me? So, and that's The first of how many sessions?
The first of 3.
3.
Yes.
So, okay. So if you're feeling a little doctor deprived, boy, have we got a solution for you. So the first 4 to 5 hours.
Yes.
Again, there's a series of tests and other assessments going on. Can you describe some of those?
Yeah, the 3 to 4 hours, that's Dr. Philippe's time with the patient.
Right.
He also has like off patient time that he does do his, collecting the data, doing his whole work behind the scenes when the patient's gone in order to determine the treatment program that is required, which is not even part of that. But anyhow, 3 to 4 hours is what he puts in and dedicates with that patient of their time. So thorough medical history review.
Right.
Several tests are done during that assessment time.
Okay.
Then again, they would, go home, come back the following day. We like to do the assessments a day after day pattern.
Oh, okay.
So 3 days back to back. We want to see how the body reacts to a 3-day period with the assessments. How, is chronic fatigue a factor from the 3 assessments? Want to see the different symptoms out of the assessments that happen or occur.
These tests that you described taking place in the first assessment session,
Yes.
do they get repeated in numbers 2 and 3 as well?
Some of them do, and there's a reason for that as well. In lay language, non-medical terms, I will say is it's kind of also like a memory thing for us as well. If, we are well, we drive somewhere, we will say, hey, I remember going there, even though we may not remember a certain address.
Mm-hmm.
For example, hey, I know it's past this turn, there you go, boom, I'm going to get there.
Right.
Whereas, if you repeat something with a person who's not so well, they can repeat it the second day, which is the second assessment.
Right.
However, the third, they will not.
Oh, really?
The third is actually where we get the results that we are looking for. And it's a proven fact that Dr. Philippe has come to this decision after 30 plus years of experience that
Right.
he has. So and this is what we do as well in our clinic, and it works quite well, I would say.
So, Dr. Philippe, after having seen a typical patient for, as I'm just doing the math here, anywhere from maybe 12 to 15 hours in these 3 organized assessment meetings, then and only then, after you've gone through your pattern of assessment, are you in a position to begin to organize a program for that individual. How long does it take you? As Sonia just said, you've been at this for a while now. But how long, recognizing the individual needs of the people that you meet in these assessments, typically how long would it take you to sit down and design a therapy program for a patient?
It is an ongoing process, starting the first hour of the initial step of the assessment. Sonia described very well. The fact we have 3-step assessment is also to explore the patterns that may vary through time from a session A to session B and session C. And that pattern change is a key to understand brain performance vulnerability, for example,
right,
and insufficiency, about compensation or loss in controls, or a lot of things can come to the picture.
Right.
So during this process, I get to understand better what are the mechanisms affected behind the performance through the testing we provide to the patient.
Okay.
And the repeatability of patterns or not will be a big cue. There is as much difference between this pattern between 1 session to 3 than you would have between a snapshot and a motion picture, because a snapshot will never reflect what a motion picture can show in 3 slates.
All right.
So that is a very key. Now, answering your question about how long it takes to design a treatment program,
exactly, yeah.
It is an ongoing process through the 3-step of these things, because it is a constant discovery, and we are digging and looking for issues which are possibly underlying symptoms and the loss of performance.
I think also watching Dr. Philippe also working with a patient side by side during the 3-day process, especially, I don't think there's a set number of hours I'm going to answer for him on his behalf that he puts in.
Right.
It also depends, I would say, the severity of the condition.
Right.
So if someone comes in, he can do a treatment process or a customized treatment program for them much sooner or quicker than someone with, a heavier, we would say, patient coming into us with a condition, because that will take him even throughout say, a treatment program he's designed that would take him, say, maybe 10 hours, 15 hours, 20 hours for him to design, he's still adding things along the way.
Sure.
So it doesn't really ever end.
Right. J.C. Gordon, just before we take the break here, you mentioned something a few minutes ago. You said NeuroKinetics Clinic is all about brain optimization. What do you mean by brain optimization?
This is not going to be a medical answer.
That's good. That's fine. I'm not a doctor. We've already got one doctor in the room.
We got one doctor here.
Please, on behalf of those of us who haven't attended medical school, what do you mean by brain optimization?
Very simply, optimizing the brain allows anybody to be a peak performer.
Okay.
To achieve life, to do life to the best of their capabilities and ability.
Okay, so that would, and I'm in a very non-medical way interpreting that to mean freeing the brain of encumbrances to charge forward and do what it was best designed to do. I'm getting a kind of an affirmative nod from Dr. Philippe. Am I on the right track?
Yes, you are.
It's restoring the brain, I would say, to help heal the body and mind and gain its function back.
Right.
That's the best way I would describe it.
Okay. We have some stories to tell, too. We're going to take a quick break here, and these are good examples. Some of them are professional athletes, names you might recognize, hockey players, football players, and so on, and others are just regular folks who needed Dr. Philippe's help. And just before we take the break, you wanted to jump in one more time?
Yes, just to add a little qualification on
Sure.
the definition of what is a treatment program as we understand it.
Okay.
You may compare a treatment program as a flight plan for an aircraft. And a flight plan is determined according to what is seen at first, but may be altered through time,
Sure.
looking for what is the best to restore physiology back.
Right, because you file a flight plan and you intend to go from A to B on this line. But sometimes weather and other things cause you to get to B in a slightly different way than you had originally planned. And that's the kind of flexibility you must bring to the table with you every day.
Exactly.
Interesting stuff. Our guest from NeuroKinetics Clinic in Vancouver in the Highcroft Medical Center at 3195 Granville Street and online at neurokinetics.com. Back with lots more right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. This is Boomer Life on CIL 650.
Sun shining up to spread. It's just like the fella said. Tell me quick, ain't love a kick in the head?
Welcome back to Boomer Life. Ain't that a kick in the head? Our guest, Dr. Philippe Silvestre, the founder and director of NeuroKinetics Clinic in Vancouver. Quite appreciated that. Our producer, Dwayne Bishop's selection of tunes there. Also in studio with me, Sonia Dale, the clinic manager, and J.C. Gordon, director of liaison and logistics for NeuroKinetics down there in the Highcroft Medical Center on Granville Street at 16th Avenue. We're talking on the program today about performance enhancement and restoration. And we're really, really lucky and quite pleased to welcome Alex to the program. Alex is joining us on the phone. Alex is from Whistler. He is a competitive slope-style mountain biking kind of guy. Alex, welcome to Boomer Life.
Ah, perfect. Thank you. Yeah, glad to be here.
It's a pleasure to have you with us. You sound like a pretty young guy. Tell us about your experience with Dr. Philippe in NeuroKinetics. Did you go to the clinic because you got busted up in a bike accident?
Well, initially in 2013, I came to the clinic because I was suffering from post-concussion syndrome, and I had been seeing a clinic in Calgary, but wasn't seeing the results that I was looking for.
Okay.
So it was really refreshing to come across the NeuroKinetics Clinic here in Van and kind of have a progressive outlook on concussion rehab and specifically for my post-concussion.
How long? What was it that caused the concussion in the first place? Was it a sporting accident? Was it a bike thing that you?
Yeah. I was snowboarding in Calgary.
Okay.
And, I had what I considered to be a mild concussion and didn't probably take it as seriously as I should have. And I mean, with my long history of concussions, I guess I was made aware that a smaller impact can cause more damage. So I didn't take the time that I needed to recover, and then shortly after started seeing some post-concussion signs and symptoms.
And what did you have to live with, and for how long, Alex? How did your life get turned around with these post-concussion symptoms?
I don't know. It was like a 3-month period where I saw zero progress in the direction that I wanted to see. Like, I was not recovering. Like, I was having headaches every single day. Like, I was fatigued. I felt like my brain wasn't working to its full capacity. Like, I couldn't use the words that I wanted to use and carry a conversation the way I was used to doing.
Wow.
And I mean, it's always a difficult thing to use your brain to assess how your brain's doing, right?
Yes.
I just felt groggy and was not having it, and was looking for an out, was looking for something to change the game.
And when you when you came to NeuroKinetics, how did you find out about them? First of all, did you find out
a simple Google search?
How about that?
Concussion rehab, and then this was when I was over in Alberta, and I was staying at my uncle's place. But I was moving out to Whistler to start a new job, and it was pretty important that I get back to the physique that I was used to.
Sure, of course. And so how long after you moved back to British Columbia did you see Dr. Silvestre, and how long, Alex, did it take for you to kind of feel that you were in the right hands?
Well, I mean, initially I felt in the right hands. Like, it was quite a stressful process, but I felt like this was the road I wanted to go down as soon as I kind of stepped in the front door and had the initial chat. And obviously, before I had the initial chat, I was able to talk to previous patients of the NeuroKinetics clinic, and I felt like the conversations I had there were like those people were in my situations before and kind of had the results that I was looking for.
Oh, so you were able to consult with other people who had already been through the program to their obvious advantage, and that sort of energized you to keep going forward.
Yeah, definitely, exactly.
Interesting stuff. And how was dealing with Dr. Philippe? How was that whole experience?
Oh, it was good. He's quite a personality, and he's quite a presence, and he's super passionate about what he's trying to do out of the clinic, and that definitely relates with a lot of patients, I think, when they see that sort of compassion, that sort of energy behind what we're all working towards. I think it definitely helps getting to the goals.
Well, now, the good news portion of this program, I am delighted to pass along, is that just a couple of short weeks ago, down there in the Kootenays in Rossland, British Columbia, you had your first podium appearance as a slope-style mountain biking kind of guy. And does Dr. Philippe deserve any credit for that, or are you going to take 100% of it yourself, Alex?
Well, I don't know. Unfortunately, this year, I had done the rehab in 2013, and we had some ongoing follow-up stuff, but in mid-August I ended up having another impact and getting quite a lot of whiplash trauma, essentially, and some of those signs and symptoms kind of had resurfaced. So I went into the clinic, and
so you went back?
Pardon me?
You went back to the clinic?
Yeah, I went back to the clinic because I saw these signs and symptoms, and it wasn't a terrible concussion that I'd received, but I noticed that it was small enough to cause me the problems that I had before.
Right.
So I went in, and we kind of jumped on the bandwagon early and dealt with some injection therapy in my neck to kind of rearrange what had been with the impact there. So got that straightened out, and then I was also able to get back on the BRE insoles, which definitely helped me with the competition that kind of happened the couple weekends after.
So you were working on many different fronts. You had insoles, you had some neck therapy. So really, Dr. Philippe, as you listen to Alex with a big smile on his face, Alex, I got to tell you, Dr. Philippe is just beaming. It's nothing more satisfying, I would imagine, for any doctor anywhere than to hear kind words from a happy patient.
Well, it's good to hear. My pleasure.
Dr. Philippe, talk to us about Alex and how the two of you worked together to get him a win just a few short weeks ago.
We are a heavenly team, isn't it, Alex?
Yeah, no, it's great.
You know, I want to comment here. I am nothing without the patient. It is important. We are a team. The team is a dimension I cannot do anything without.
Right.
Without the patient, I am nothing. And we are pretty even because usually the patient needs the adequate help, and without me for now, the patient is not that much. So it makes us very much even in a relationship, and it is a wonderful teamwork.
I wanted to ask you about Alex's specific story because, Alex, you told us you had a concussion, a fall in 2013, and then you, a couple of months ago this summer, you took another tumble and banged yourself in the head again. And I was watching Dr. Philippe's face as you were describing these, and you said with the first one that you said you thought it was kind of a mild concussion. And I wanted to ask Dr. Philippe, is there such a thing as a mild concussion, or is that an invention of our brain?
No, it is a real thing.
Okay.
You can have from minor to severe concussions. And of course, the severity of impact is what makes that gradient in severity.
Okay. So in Alex's case, though, once you've experienced one or more concussions, you are then predisposed to be more seriously injured by what you might consider, or might in the past have considered, to be a mild concussion.
Exactly, and that relates to brain physiology and the state of the art of what we know in brain-related neuroscience.
Right.
When we get hit and we are not resolving the full extent of the trauma impact, what is residual left will be compounding with a set of issues brought in by the next impact. So we have a compounding of adverse effect, and that means an adverse momentum is taking place, which will make that patients or that performers very much accident prone, to say the least.
Right. So, Alex, you've learned, obviously, from Dr. Philippe, because you were back over the summer again, that you have this because you've experienced, because you're a very active, athletic guy, you're a mountain biker, you're a snowboarder, you're out there just getting banged up every chance you get. So you're learning, though, that when you do suffer a head injury of some kind, that it's really important in your case, because you've experienced them in the past, to get it checked out right away, right?
Yeah, no, there's a leg will heal by itself, right? Like, I mean, obviously there's a little bit of bone setting, but the brain is not something to be reckoned with. Like, you just need to give yourself that time to recover, and that's the most important, right? Like, you can't be pushing the envelope right away.
Right. Yeah. All right. Well, Alex, thank you so much for being with us today. Congratulations on that first podium appearance down there in Rossland, and we wish you many, many more as you go forward.
Perfect. Thanks again for having me on the show.
Thank you very much, Alex, for your time.
See you, Alex.
Our pleasure. There's Alex, who is a slope-style mountain biker, joining us from Whistler on the program today, a patient and remains a patient of NeuroKinetics. And Dr. Philippe, when we come back from the break, you can talk to us a little bit about, Alex mentioned a couple of specific therapies that he had received and that you and he had worked on. You can talk to us because we were talking earlier about designing programs. So you can tell us how you matched Alex's requirements to your therapies. It's Boomer Life here on CIL 650 with the folks from NeuroKinetics in studio, and of course online. We encourage you to visit the website neurokinetics.com while we take this quick break.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL. This is Boomer Life on CIL 650.
Welcome back to the program. The doctor is in on this edition of Boomer Life. The doctor is Philippe Silvestre. He is the founder and president of NeuroKinetics Clinic in Vancouver, and he brought J.C. Gordon, director of liaison and logistics, and Sonia Dale, the clinic manager, along to this edition of the program as well. We just heard from Alex, the mountain bike rider, a very athletic young guy who came to see you a couple of years ago, Dr. Philippe, based on a concussion. He had been receiving some treatment in another province. He was dissatisfied with his progress. So when he moved back to BC to take his new gig up in Whistler, he found you in a Google search. That's how hard NeuroKinetics is to find. And he popped it by the shop. And I assume, Sonia, went through the standard 3 assessment visits as everyone else does, right?
Yes, he did. Yes.
Okay. So once you determined and had seen Alex for those 3 visits, Dr. Philippe, you designed a program for him, which he's still participating in. What did you do for him?
So we applied a structure which is adequate to a given patient. We have commonalities, we have also specifics to handle a particular case. So the commonalities is we basically blend Western medical knowledge with the tools and techniques available from Eastern medicine.
Right.
I am not a licensed medical doctor here in the province, but this is only due to politics. I am only licensed as an acupuncturist, which is already a little hanging on which allow me to provide my expertise.
But you used some acupuncture strategies with Alex, didn't you?
Yes, we do. As always, as we always do.
And he talked also about some kind of insole. So you gave him, again, once the assessment was over, you were able to identify a physical area that needed some attention as well.
Okay, and when we speak about insoles, it is not about correcting a foot, which is outside of my scope of practice.
Right, sure. You're not a podiatrist.
I'm not a podiatrist.
Right, yeah.
What is in insole is a way to stimulate energetics according to Eastern medicine and also the nervous system. Subsequently, that is an overlap in the light of brain performance and brain physiology.
Okay.
And it's called biomedicine, it belongs to what is called as a medical field biomedicine and functional medicine, which is bridging Eastern medicine and Western medicine. And it is an emerging domain over the past 10 years, very, very strongly worldwide. So what is in an insole is basically a tool, a device, which is called a biophotonic device, and is basically a device which interferes with quantum emission or emission of photon, which is emitted from the body. It is a physical phenomenon which is now extremely well known and understood that relates to brain performance and brain regulation.
Well, isn't that fun, JC, that you can put an insole in somebody's shoe and have it directly affect their brain and that whole optimization you were talking about earlier?
Absolutely, and again, that's one of our specialties, is to optimize the brain. And as Alex mentioned, it wasn't until he came back to see us after his second concussion that we added the BRE device. And for Alex, his performance allowed him to actually be on the podium for the very first time.
And we began this program talking about performance enhancement and restoration, which we actually now have learned that it should be performance restoration and then enhancement. But in Alex's case, that's what happened. He had his performance capacities restored and used them to max and won something.
Yes. It's so rewarding, Sterling, to hear the stories of our patients as they reach their levels of potential, because we all have potential, and that potential can be realized when the brain is optimized, dysfunction is eliminated, and the brain is functioning properly.
I think, Dr. Philippe, too, and I know I'm repeating myself here, but I think in terms of this episode of Boomer Life containing a really important lesson for anyone listening, it's Alex's story in terms of his concussion. And he's a young guy who's got a lot of athletic years and a lot of hills to pound down on that snowboard, to say nothing of that mountain bike. But he's got to be careful, because one concussion opens the door to an even smaller injury, an event creating still even larger problems. Talk to us about the importance of concussion health once you've experienced one.
Well, in matter of concussion, prevention is everything, and prevention will start with checking the brain functional state if there has been in the past a history of concussion, even mild. Because when our brain gets unset or shattered and we become somehow even slightly dysfunctional, the cognitive processing is altered.
Right.
And remember, this cognitive processing is comparable to the software in your computer.
Right, and Alex called it just being off his game. Nothing was working anymore properly.
Losing the edge.
Right.
Losing that tune, which makes the performance optimum or not, and effective. So when we get in that stage, which is an altered stage, we become the worst. We get into the worst place to become our own evaluator and judge,
yes,
because our screening process is itself altered. How can you evaluate and gauge something
while you're
with
also
a wrong
developing
compass?
a coping strategy?
And you cannot
can't
evaluate. You
can't
lost
do
your
those
gauge.
two things at once, can you?
You lost your gauge.
Right, exactly. Okay, so again, and JC, this again speaks to people who are hearing about neurokinetics perhaps for the very first time. And a great example with young Alex joining us, because here's a young guy, fit as a fiddle, but just took a few too many bumps. And now he's back out there. He's not going to stop. And now he's winning. And I'll bet you, being a lot more careful in the process.
You know, it's a good lesson for anybody out there, any of our listeners that are out there, to know that there is hope.
Right.
That you don't have to live with how you're feeling now, that you can reach your optimum potential.
And that's what Alex said. He came back. He'd been receiving treatment elsewhere, and just it wasn't right. He didn't feel right. He was still suffering from post-concussion symptoms. He was just off his game. He'd lost his edge. So the folks at NeuroKinetics just did it. They just put him right back, and as it turns out, on the podium for the very first time. Our thanks to Alex for joining us. And Sonia, JC, and Dr. Philippe, so much fun having you pop by on Boomer Life. Shall we do it again in about a month's time?
We shall.
All right, well, we'll see you then, and we'll see you next time right here on Boomer Life on CIL 650.